Nearly every single individual, team, and organization have had to adjust their goals and strategy based on the health crisis that we're experiencing across our world. We're hearing this internally. It's certainly a hot topic of many MMIT Zoom rooms. As we enter our 9th or 10th week of working remotely, I'm not sure, I'm starting to lose track. But we're hearing these same struggles that we're dealing with from our client base as well. For today's session, I really want to hone in on one specific example. Let's look at the facts of the case on my slide. This was a marketing team from a healthcare IT organization that we were working with. They came to MMIT seeking current information on the impact of COVID-19 to make sure that their marketing team was approaching their launch strategy appropriately given the major shift in dynamics. At MMIT, we found that the best thing we can do during these uncertain times is to remain agile and as informed as possible. The information and the impact of COVID-19 is changing daily, hourly even. Through our own AIS health journalists based out of Washington, D.C., we've been extensively covering the pandemic with nearly 2 posts a day to our blog and tagging them appropriately so that our clients can quickly filter down to what's going to be impactful to them. Is it going to be a specific account or a new regulation in California? But being able to provide that agility to our clients is really important. But the big problem that this marketing team was faced with was the lack of data to support understanding the enrollment shifts given the massive job loss that we've experienced in the US over the last 60 days. We're going to dive into some specific data that the MMIT research team was able to produce to be able to provide to this marketing team the insight that they needed. Our teams are trying best to synthesize what matters so that our clients can react to the dynamics in real time by providing the insights that you see on the screen. Like on the left side, a heat map that quantifies the job loss rate by state. This is our attempt to be able to help clients understand the expected expansion of the Medicaid channel while employees lose their previous employer's health benefits. We also had to go outside and procure outside data to help put the shifts into context. Like on the right side of my screen. It may be a little bit hard to see on the webinar, but that dark blue is showing that over 40% of people who lost their jobs early in the pandemic didn't have insurance at the time of their layoff. This is based on analyzing a lot of public records that showed the large majority of individuals who lost their jobs were in the service or the gig industry. So think your Uber driver, baristas, bartenders. The model that our data scientists are building indicate that the shift to Medicaid effective in April or what we can see from early May could be just 15% of people who lost their jobs now enrolling into Medicaid plans. Which may sound like a small number, but 15% of tens of millions of people is still a large number. Not to mention that the delay in live shift from commercial to Medicaid insurance could be delayed for certain temporary relief programs that employees are being offered, such as furloughed employee benefits or COBRA. And also just the pure administrative delay that these Medicaid enrollee processes are overwhelmed, especially in states like California that have been really hit hard by this pandemic. The data and insight that I just summarized on the previous screen was shared with the marketing team, and it enabled them to reformulate their strategy with confidence, now understanding the COVID-19 impact on the channel distribution of lives. It's now more important than ever to make sure that the insights your organization are producing are timely and relevant because the amount of data being pushed out about COVID-19 at this point is somewhat overwhelming.